Since 2016, the Flint Registry has made a real difference for those living with the lasting effects of lead exposure from the man-made crisis in Flint, Michigan. I've met these children. I know these children. I've seen their illness and the sickness and what has happened. This registry was originally created as part of our nation's response to the Flint water crisis and funded for 4 years, but it expired in 2021. While it continues to receive funding through the annual appropriation process, authorizing this resource for another decade is critical in addressing the continuing health needs of the Flint community. We all know that there isn't a safe level of exposure to lead, period. There is no safe level. Exposure can lead to lifelong severe consequences on one's health. And these effects are especially serious for children and can lead to slow growth and development, learning and behavioral problems, and damage to the brain, among a host of other harms. I've gone with mothers to the hospitals. I have called doctors and gotten help for these mothers that are in tears because they're desperate because their children are so sick. And that's why I have worked alongside the Michigan delegation and my other bipartisan colleagues in Congress to address the Flint water crisis through the establishment of the Flint Registry. It has been a powerful tool in helping residents minimize the impact of lead-contaminated drinking water on their health. To date, the registry has enrolled over 20,000 people, proactively identified health and development challenges, and completed over 30,000 referrals to critical lead exposure mitigating services like healthcare, nutrition, early education, lead elimination, and more. As originally intended, the Flint Registry is improving public health. The Reauthorization Act, which we're considering here today, would ensure this critical service continues to help the Flint community by authorizing $5 million in annual funding for the next decade to address their ongoing needs. It's been a resource to other lead-impacted communities like Benton Harbor, Michigan, and Newark, New Jersey. The lessons learned from Flint continue to inform and support other communities with both lead and safe drinking water issues, of which I might say there are far too many. Helping those who have suffered from preventable lead exposure should never be a partisan issue. Every member of the Michigan delegation, Republican and Democrat, was an original co-sponsor of this bill. This strong bipartisan bill reflects the exact kind of meaningful policies this committee is known for advancing. The Flint water crisis is a stain on this country forever. It should never have happened. And the people of Flint will be living with its impacts for the rest of their lives. We have an obligation to follow through on our promise to help the people of Flint recover long-term, and this funding is part of that promise. Importantly, authorizing the Flint Registry for an additional 10 years will enable this program to support kids who were newborns during this crisis, the most vulnerable population to lead poisoning, through their 18th birthday. I want to thank Chairman Pallone for advancing this bipartisan bill, and I want to thank all of my colleagues on this committee for their commitment to protecting this important public health program for Flint. As a member of the Michigan delegation, I urge all of my colleagues to support this bipartisan and incredibly important legislation so we can get it reauthorized without delay. I've seen the difference. I know what's happening. I visit Flint regularly. There is a baby that I helped a mother get to a child that is still experiencing health problems. I feel a moral commitment to those parents of Flint. Those kids need our help. Thank you, Mr. Chairman, and I yield back.